Hey everyone, in this video I'll be discussing the antidepressant mirtazapine. Mirtazapine is most commonly known by the brand name Remeron. In terms of its class, it's a noradrenergic and specific serotonergic antidepressant. Mirtazapine is also often referred to as an atypical antidepressant along with medications like trazodone and bupropion. Moving on to pharmacokinetics, mirtazapine is metabolized by the liver. It typically reaches peak plasma levels within 2 hours. Its half-life is somewhere between 20 to 40 hours, and it's metabolized by CYP1A2, 2D6, and 3A4. Now this is where things kind of get interesting because, as you can see, mirtazapine has a bunch of different mechanisms of action. So I listed them all out here and we'll go through them one by one. So starting off with its activity as an H1 antagonist, this leads to sedation and some weight gain. Then it also acts as a M1 antagonist, which can lead to some dry mouth and constipation. It also acts as an alpha-1 antagonist. So it's important for patients who are on this medication to watch their blood pressure and watch out for any possible orthostasis. As an alpha-2 antagonist, this leads to increased release of norepinephrine and serotonin, so this is where you get the primary antidepressant effect of mirtazapine. It also acts as a 5-HT2A antagonist, so this also leads to some more antidepressant effects and also some anxiolytic effects. As a 5-HT3 antagonist, it leads to some anti-nausea effects, which can be helpful for patients who are experiencing that. And then lastly, it acts as a 5-HT2C antagonist, which leads to some more antidepressant effects. In terms of indications, the only FDA indication is major depressive disorder. However, you can see mirtazapine used in a number of different settings, including anxiety disorders, appetite stimulation, cancer chemotherapy, because remember that 5-HT3 antagonist activity will have some anti-nausea effects. Interestingly, low-dose mirtazapine has been studied for akathisia. It's also been used for PTSD and possible but questionable role in cocaine use disorder. In terms of formulations, it's available as either an oral tablet or a dissolvable tablet. Typically with dosing, patients are started off with somewhere between 7.5 to 15 milligrams nightly, and then you could increase by 15 milligrams every 1 to 2 weeks with a max dose of 45 milligrams. As I just mentioned, mirtazapine can be used for patients who are struggling with sleep, but one important consideration is that mirtazapine serves patients better for sleep at lower doses, so somewhere between 7.5 to 15 milligrams or even lower than that is where patients will get the most benefit for sleep because a lower dose leads to a higher affinity for blocking that H1 receptor. So one of those high-yield associations you often hear about mirtazapine is this concept of California rocket fuel. So this is a term that was coined by Stephen Stahl, and what it is a combination of mirtazapine, brand name Remeron, and venlafaxine, brand name Effexor. So this is a combination that Dr. Stahl put forward for treatment-resistant depression, and the kind of idea behind it is that mirtazapine increases serotonin and norepinephrine via a different mechanism than SNRIs. So they're both increasing serotonin and norepinephrine, but they're doing it in two different ways. Contraindications to mirtazapine include a hypersensitivity to it and also a monoamine oxidase inhibitor use. In terms of drug interactions, one important one to be aware of is carbamazepine. You'll remember that carbamazepine is a CYP3A4 inducer, and 3A4, as we mentioned previously, is one of the enzymes responsible for metabolizing mirtazapine. So taking carbamazepine will reduce levels of mirtazapine by speeding up its metabolism. Another possible interaction to be aware of, although it seems more theoretical than practical, is mirtazapine with guanfacine or clonidine. So guanfacine known by the brand name Intuniv, and then clonidine brand name Catapres. These two medications are alpha-2 agonists, and then mirtazapine is an alpha-2 antagonist. So there may or may not be some question of whether these two medications would counteract one another. In terms of side effects of mirtazapine, sedation, realistically, this is kind of something that we actually benefit from. Increased appetite and weight gain. For patients who are struggling to eat, this could really come in handy. Always want to make sure we're watching out for orthostatic hypotension. Mirtazapine may cause some sexual dysfunction, although typically not as much as the SSRIs, and then also watch out for some restless leg syndrome while on mirtazapine. So you may be wondering why mirtazapine and SSRIs have different side effect profiles. SSRIs actually act as agonists at the 5-HT2 and 5-HT3 receptors, whereas mirtazapine acts as antagonists at these receptors. So for the SSRIs, typically you'll see GI and sexual side effects, whereas mirtazapine is acting as antagonists at these receptors, and so you get less of these GI and sexual side effects. I hope this video was helpful. If you have any questions, please feel free to leave them below. Thank you.